If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
Hello, I'm Dr. Steve Garner, and welcome to Ask the Doctor. It's great to be with you today. Now, I can't believe it. This is the premiere of our 14th season. Now, as you know, this program was created to assist you in understanding medical issues so you can take charge of your own health. It's more important than ever to become an informed patient, and we're here to bring you timely health discussions. Now, for those who are new to the show, there are two ways to get your questions in. First, you can call our live phone line at 718-499-6101. And second, and I've been getting a lot of these, email us your questions to askthedoctor@netny.net, and we're going to bring them into our discussion. Now, for this very special episode, we have Dr. Kanchmala Katapati. She's an internal medicine attending at the New York Methodist Hospital and a frequent guest to the show. We have Dr. Bruce Garner, Chief of Rheumatology. He's at Lutheran Medical Center and another frequent visitor to our show. And of course, Dr. Reginald Manning, Orthopedic medicine attending at New York Methodist Hospital. His wife is amazing, always gets the answer to the quiz, so we're very proud to have him on. And it's been a busy off season. We're back to the new season, and I thought we'd go over some of the news, what's in the news. And there was this interesting story today about working overtime and heart attacks. Anybody, I don't know if anybody saw that, but if you work 3 hours extra a day, you increase your heart attack rate by 60%. And they're not sure why. They were unable to tie it to lifestyle. Like, you figure if somebody's a workaholic, he's going to be smoking, he's not going to eat well. No, they couldn't tie it. It seemed something in the work, something about working that extra time, the overtime. So it's a good wake-up call, to take it easy. Work is something, but you want to have set time for relaxation and so on. This was a major study. Now, also, foods can have the same effect on the brain as an addict for cocaine. It's interesting. So if you see a milkshake or an egg cream, right? You ever had egg cream? You ever heard of that? It's amazing. I'm sure out there people have had egg creams, but one of the things I like to, just to take an aside from the news, if you know of a place where you can still get an egg cream, please tell me, like a fountain or someplace like that, okay? So we rely on our visitors to get all this up-to-date information. So it's interesting, if you eat a lot of food, it's not any different, they're saying, than being an addict and wanting cocaine. And that is very hard sometimes to stop that addiction. And it's interesting that the same part of the brain controls the addiction for both drugs and for food. So it's something, maybe a different approach to helping people lose weight by giving medications that help to dull or stop that area in the brain that requires them to eat so much. Now, everything, the Japanese tragedy has been on everybody's mind, and it's been a terrible thing. And fortunately, the radiation effect in the United States here is not significant. Even though we do have some radiation in New York from it, it's not enough to really hurt anybody. But what is enough to hurt everybody, or children in particular, are the abuse of CAT scans. And there was a big study that came out today that showed that we had a 5-fold increase, 500% increase in the last 10 years in children getting CAT scans. And this radiation adds up. Once you get about 5 CAT scans, you begin to get a Hiroshima-type risk for cancer. So these add up throughout your lifetime. And what was important is that when children are getting CAT scans, there were often other ways to work them up without radiation, such as a sonogram or an MRI. So it's very important to ask your doctor when your child is getting a CAT scan, is there another way to do this? And also, are you using the lowest possible dose? The study found that people, particularly hospitals where they have mostly adults, that when a child came in, they didn't change the setting and they gave them the adult dose. So you really want to ask that. You got to be educated consumer here, and you're going to really help your children by doing it. And finally, the season is here again for hay fever, right? And it's going to be a terrible season because of the early warmth and because of the rains and the snow that we had this summer. And just a couple of tips. Of course, the HEPA filters, doing away with your curtains if possible, putting a little Vaseline in your nostrils, and that helps to keep the stuff out. And taking a shower when you come in, because when you come in, you're bringing in a lot of the pollen. So just something to think about. We'll talk about that as the season progresses. And of course, the 14th season wouldn't be complete if not for Monsignor Bennett's presence. Monsignor, 14 seasons, can you believe it? He says he can believe it. All right, thank you, Monsignor. but it's great to have you here. And I want to give a shout out to a couple of people. Now, Sophie Marola, just was at Methodist Hospital. She had a little bit of a tough time. They're doing better now. Big fan of the show. She actually got discharged today so she could watch the show tonight. She actually had a choice of when to get out, so that was nice. We have a couple of our younger listeners, Christian and Bradley Bubel, who have been calling actually and discussing issues, and then Joyce Pachoda's daughters, Brittany and Rebecca. So give a little shout out to them. And we're ready for the quiz. Now get your pencil and papers ready, and this is the story. What object is the leading cause of choking for adults in America? What object is the leading cause of choking for adults in America? So you could think about that one. I don't know the answer. I have some ideas. The panel has some ideas. But give us a call, and you may be the winner of that coveted plaque. So for now, we've done everything we had to do. All the bookkeeping is done, so we're going to take a short break. And when we come back, we're going to go to your questions, where the topics will be in internal medicine, rheumatology, and orthopedic medicine. The number for you to call is 718-499-6101. And you can also email your questions, we like those, to askthedoctor@netny.net. We'll be right back. I'm Dr. Steve Garner, the host of Ask the Doctor. In addition to watching Ask the Doctor every Tuesday night at 8, you can also visit www.netny.net/askthedoctor. There you can find the topics and guests of each episode. You can read my column from the week for the tablet, and for more advice, you can watch episodes you've missed. More importantly, you can post your questions and I'll answer them on the video blog. So visit www.netny.net/askthedoctor and get your daily dose of healthy advice. And welcome back to Ask the Doctor, where our topics are internal medicine, rheumatology, and orthopedic medicine. Now let's meet the doctors. We have Dr. Karapani. It's a pleasure to see you here tonight. You've become one of our favorite guests. You always wear interesting colors. You know, it spices up the show.
Spring, you know. I got to bring in spring even if outside the weather is raining.
I know. What's going on out there?
I
don't know.
I know.
But this is a Stuyvesant-themed show. Now, we'll talk about Stuyvesant High School, probably one of the best high schools in the country in New York City. And we have a connection here. Now, Dr. Karapani, what's your connection to Stuyvesant?
Second daughter just got into Stuyvesant High School.
Is that the famous daughter that had the TV appearances?
No.
Oh, that's okay.
That was my first one. She's at Bronx High School. So.
Oh, so you did well. You got the daily double. Fantastic. Yeah. That's great. So we're going to get a lot of questions about internal medicine, some hard questions. I know you're getting ready to answer those. And thanks again for coming. Dr. Bruce Garner, what's your connection to Stuyvesant?
My oldest son, Ben, will be graduating from Stuyvesant High School, God willing, if he's studying his math and not watching this program right now. He's the president of Arista, and he spoke at the open house.
I know, you did a great job. I was there.
Thank you very much. And my younger guy, Kenny, is at Brooklyn Tech.
Brooklyn Tech, so we've got Bronx Science, Stuyvesant, Brooklyn Tech, and Stuyvesant. Tremendous, and we're going to be talking about some new rheumatology issues. Some new studies that have come out, again, about glucosamine, about vitamin D we like to know about. So I know they've got a lot of questions, and we got a full house here.
Great.
And Dr. Reginald Manning, what's your link to Stuyvesant?
I graduated from Stuyvesant many years ago.
Many years ago.
Many years ago.
Yeah, were there women there at that time?
My senior year is the year it went co-ed. That was 1969 to 1970.
Amazing. And was that a tough time, 69 to 70?
I think so. A lot of unrest in the country and the world.
At the Kent State tragedy, you had women's lib.
Southeast Asia, women's lib.
We had
Earth
Woodstock
Day.
Around then?
Yeah.
Did you miss any school?
I can't say.
But anyway, so...
my mother would kill me.
She is watching the show. I think we heard from her before the show.
I think she's watching.
You were trying to explain how to get Channel 30. You said go to 29, and then it's going to go.
It gets complicated.
It's good. But, and we got some new orthopedic material?
Robotic surgery is, I don't do that, but it's coming along the line for hip replacements.
Fantastic.
And we'll see if it works or not.
Beautiful. We're going to talk about that. So now you've met the crew, and what we're going to do is see who our first caller is. It could be Maddie. It could be Joel. Let's see who it is. Hello? Hello?
Dr. Garner?
Yeah, who is this?
Ralph.
Ralph, good to hear from you. You're first caller of the new season. You aware of that?
Amen. I'm lucky.
Yeah, you make it into the annals of the history of Ask the Doctor. It's very good. Where are you calling from?
Rockaway.
Whoa, way out there.
Yes.
So what is the story out in Rockaway with food? There's just about no restaurant out there, maybe Kennedy's?
Yeah, that, but our favorites are Bracciamento and London Lenny's.
Oh, Abbracciamento,
Abbracciamento.
not in Canarsie. That's gone, right?
No, this is on Woodhaven Boulevard.
I know it well. Yeah, is that the sister, I think, of the other Abbracciamento?
Right.
And London Lenny's is always consistent, right? Good,
Right. Love it.
It's always bad. No, it's good. It's good. But what can we do for you?
Well, for the past several years, periodically my back would go out, and for days I would walk bent over. X-ray shows it to be arthritis. Last year, I started to get a pain in my left hip that would run down my leg.
Speak up a little bit, Ralph.
What's that?
Talk a little louder. That's good.
I started to get a pain in my left leg that would run down my leg. My rheumatologist thought it could be sciatica. I got 2 steroid shots in the hip and physical therapy 3 times, including 10 steroids, 10 electrodes, but the benefits never lasted. Now when I try to sleep on my side, which is mostly the left, the pain in the hip and leg makes it impossible to get a good night's sleep.
How old are you, Ralph?
79.
79. You overweight at all?
No.
Very good. So let me get right to Dr. Garner.
I got more to go.
No, but I want to keep up with it a little bit. So we got this pain going down the left leg.
Okay,
Yeah.
well, if you have the pain lying on your side at night, it might be more in the thigh than the hip, and it could be what we call either a trochanteric bursitis or a tendinitis over there. And sometimes an injection just into that area, Ralph, is enough to take care of the pain. What did the X-ray show? You said they looked at the back. Is there a pinched nerve that you see on an X-ray or an MRI or a CAT scan?
What I was going to say is that I've tried the heating pads and hot water bottles and patches and lidocaine gel, but never works for long. I recently had an MRI, and the report said I had a herniated disc. And I feel the problem may be in my leg socket, since the worst pain comes when I lie down. And just for your information, my left leg is shorter than my right leg. That's all I got.
Well, in that case, I would refer you to a good orthopedic surgeon such as Dr. Manning. I'm going to let him take
So
that.
Reggie, what about this herniated disc? Does that mean surgery?
Not necessarily. I was thinking that might have been the diagnosis from his symptom presentation. If it's a small herniation, usually you can keep that under control with anti-inflammatories, sometimes other modalities such as injections. Large herniations or ones that are sequestered may require surgery. But you can try physical therapy modalities first and see if that gives you any relief, anti-inflammatory medicines, and sometimes injections.
So Ralph, where do we stand now? You still have the pain?
Yes, this afternoon I tried to take a nap, and then I lie on my side, and then the pain comes, and that's the end of my lying down.
You should probably see a spine specialist.
Yeah, you know, we can refer you. If you give us a call after the show, we'll give you a good spine specialist. Let him get in there and take a look. Because it sounds like he's tried conservative measures, and now it's ready to move on. All right, Ralph? So we'll give you a good referral.
Thank you.
Okay, take care. It's a lot. People have different size legs. You know, one guy's got a left leg shorter than the right. Is that common, Reggie?
Not very.
Okay.
Roughly about the same size.
Usually they're the same size.
Yeah.
Okay, very
Yeah,
good.
but they need to use a shoe insert to correct that, because that leads to a lot of spine problems.
I
you
wonder
know?
if that's giving him a little
Yeah,
problem.
he
It
should
depends
probably
on the
see
deficit. If it's
a
less than a
podiatrist.
centimeter, probably not, but more than a centimeter could be a problem.
Interesting. Okay, Ralph, we hope that helps. And now we're going to go to Grace, one of our longtime loyal listeners. Grace?
Yes.
Grace, how was the off?
Yes, coming along fairly good.
Very
but
good.
I'm still with the pains in my knees. So I on both knees I tried that 2-part injection, but they didn't help me at all.
Very good. So Grace,
So I'm on Sulindac, my medical doctor, and I find that helps me. For the last 6 months, I take it maybe once or twice a week. Is that all right to be on inflammatory Sulindac?
You bring up an excellent point, Grace, and actually this is something I'm glad you brought up, because there's an article which appeared just a week ago looking at Sulindac and all of these types of drugs called non-steroidal anti-inflammatory
is that like
drugs.
Motrin?
That would be like Motrin, it would be like Voltaren, diclofenac, Aleve, naproxen, aspirin, all of those painkillers other than Tylenol, which are not narcotics or barbiturates, they're anti-inflammatory painkillers. And we learned, if you remember, there was a drug called Vioxx, which unfortunately had to be taken off the market, because what happened with Vioxx was it caused cardiovascular problems. And the fear is that perhaps all of these medications could cause cardiovascular problems. What they found out, they looked at 1 million people who habitually use these NSAIDs, meaning more than a few times a week. over 9 years, and they found that the risk for cardiovascular problems is different with different medications. The safest one is naproxen, which is the active ingredient in Aleve. Those which pose the highest risk were diclofenac, which is also called Voltaren, and believe it or not, Motrin, ibuprofen, which is available over the counter as Advil and other names, pose high cardiovascular risks. Sulindac, the gentleman who trained me did much of the work on, and Sulindac is one of the safest ones regarding the kidney. If you take it only 3 times a week as you are and it's helping you, that's fine. Remember not to take it on an empty stomach. And also remember, it could affect the kidneys, your blood pressure, and your liver. So you need to go to your primary care doctor, a good primary care doctor like Dr. Katapati, and get your blood pressure checked.
Reggie, what about the knees?
Well, I was thinking if she's taking medicine more than half the week and is taken for a long period of time, depending upon what an x-ray shows, she may be a candidate for knee replacement surgery. That would solve the problem and get her off the medications.
Grace?
Yeah.
We're going to have to leave you, but do you have an answer to the quiz?
Is it food or an object?
Well, the answer is what object is the most common cause?
I understand, but are you considering an object to be food?
Food is an object. What are you thinking of?
Well, Frankfurter.
A Frankfurter. Okay, I've got to go to our judges because I don't know the answer to
I was going to say
that.
ice cube, but you said food, so I was going to say an ice cube, but being that you said it might be food.
Grace, you want to switch to ice cube or are you sticking with Frankfurter?
I'll stick with... I'm trying. It's a toss-up now. It's a toss-up now.
Okay, great. Let's go with hot dog. Is that all right?
What's that?
We're going to go with Frankfurter.
All right.
Okay, Grace says Frankfurter. Could that be the answer? Grace?
Yes.
When you've stumped the sound effect people. They're trying to figure out how to make this noise. I don't know if you're right or you're wrong, but I'm going to keep your answer.
Yeah, wait. I have something to tell you. That lady with the pain, not that I'm a doctor, but I had sciatica, and Flexerol used to cured my sciatica. Flexerol.
Flexerol. You have any luck with Flexerol?
Oh, yeah, it works. It works. I mean, if you have muscle spasm, it works. So.
Grace, I got some bad news. Grace?
Yeah, I selected the wrong one. I should have stuck with ice cubes.
I'm sorry, Grace. It wasn't Frankfurter, but have a good night, okay?
All right, thank you.
Take care. They take it to heart. But it is a nice plaque. Reggie's wife actually has won a plaque.
I haven't seen it.
Yeah, she won't
She
show
won
it.
it, but I haven't seen it.
But before I go on, and this is not like a Jerry Lewis telethon or anything, I just wanted to mention that the Net, just like any other nonprofit organization, is feeling the pinch of these tough times. And again, it's not a pledge drive, it's just me telling you what's going on here. So if you enjoy your programs such as Ask the Doctor or Ask the Doctor, then please show us your support. Now, whatever amount you can contribute is much appreciated, because the main thing that we know is that you care and support us. Also, if any business out there would like to partner, sponsor a show, then you can contact the number on the screen. So I want to thank everybody. If you give, that'll be great. If you don't, that's great too. And I want to get on with the questions now. So who do we have? We have another Grace. I think this is Grace calling back with ice. Grace?
Yes.
This is not the same Grace, is it?
No, this is a different one.
Oh, talking to the phone. I like to hear the voice.
Okay.
Where are you calling us from?
No. I'm calling from Bay Ridge, Brooklyn.
Bay Ridge. That is a mecca of restaurants, right?
Yes.
Which one are you gonna go with?
With restaurant?
Which one? Where's that? Which restaurant? Do you like Tuscany Grill?
Yeah, Tuscany Grill.
See, very good.
You read her mind. Huh?
Yes.
It's a little place, but it really gives you nice service, and it's good. It's good. So I suggest people to get out there and see that. So what can we do for you, Grace?
I have a question for Dr. Gardner.
Okay, he's right here.
Yes, I have been diagnosed with fibromyalgia.
Okay. All right, well, let's talk about fibromyalgia.
Okay, that's amazing,
I
Grace.
was wondering if I will have to live with this for the rest of my life,
Well-
or will it eventually go away by itself?
Well, let's first discuss what fibromyalgia is. And there's a little bit of controversy as to whether or not fibromyalgia is truly a disease or a syndrome, or in fact, it's the body's reaction to stress. Some experts feel that it's stress, anxiety, and depression. There are other experts who feel, based on studies which have been done, that people who have fibromyalgia, which is a chronic pain situation, where people feel pain and fatigue all the time, the minute they get up in the morning, even if they had a good night's sleep, and most people with fibromyalgia don't have a good night's sleep, but even if they had a good night's sleep, their sleep is non-restorative. They feel like a Mack truck ran over them. The good news is, if you do have fibromyalgia, there are many things which can be done to help it. There are medications such as Flexeril. Antidepressants seem to work very well, not just for depression or stress, but to help block the transmission of these pain impulses across the nerves. There was a study.
Let me just ask a quick question.
Yeah.
Is this something she's going to have to live with all her life?
Well, there was a study which just came out a few weeks ago that showed that if people with fibromyalgia exercise, they seem to make a much better recovery. If you don't do the exercise, you don't take the medication, and you don't educate yourself about this disease, then you're not going to do well. Yes, you probably will have to live with it your whole life, but the extent of it will be much less. You'll be able to live a long, fulfilling, healthful life if you do what your doctor tells you.
Grace, hope that helps. Sounds good.
Yes.
Be well. We're now going to go to Judith. Hi, Judith.
Yes, hello.
Hi, Judith. Where are you calling us from?
From Marine Park.
Marine Park.
Yes.
What do you like to eat out there? You ever go to Jay and Lloyd's Delicatessen?
Mill Basin.
Mill Basin Delicatessen you like.
Yeah, Mill Basin.
Very nice. You ever go in there? Let's get this artwork from Earth.
Yeah, it's very nice. It's very nice. What I was calling him about, I was going to go answer the question.
Okay, we're ready for
Okay.
that.
All right, try a peanut.
You say, is it peanuts?
Peanut. And,
Okay, I'm going to ask our special effects special team.
okay.
Is it peanuts? Okay,
And I do have a question for
but
him.
first, I have bad news for you.
What?
It's not peanuts.
Okay.
All right?
Can I ask him a question?
Yeah, sure. Who do you want to ask?
I think the rheumatologist.
What are you giving him? He's getting all this
Popular
business
I
here. Okay. What can we do for you?
Why didn't some of you come to my office? This is for free. I have a kid I got to put through college, so go ahead.
Fatigue, feeling fatigued, tired. I had gone for a blood test. That seems to come out, okay. And I think he recommended I should maybe try a rheumatologist. What exactly do they do?
Well, what a rheumatologist does, and that's one of the reasons why I like the specialty, we're sort of mystery solvers. I always like to read detective novels and mystery novels. And when nobody else knows what's going on, sometimes it's a disease which we treat. And those diseases would be called autoimmune diseases. Now, you begin again by going to an internist like Dr. Katapati. If you're tired, she would check your thyroid. She'd check your blood pressure. Well, let me ask you, what would you do? Let me not speak for you. You're sitting right here. What would you do?
But
when a
just
patient
hang on
comes
1
in
second.
initially?
Yeah, what would you do? The patient's tired.
Well, basically, get a good history. First of all,
Right.
how old are you?
72.
72. Okay. And you said all your blood work was normal. So
Yeah,
a good
basically,
history and physical
it was-
to find out if you have any other symptoms to go
The
along with
sugar.
that.
Sugar is high.
Sugar is
Sugar
high.
is
That
high.
high,
Yeah,
but
so
not
definitely.
that high. No, I really shouldn't feel this way. Plus, I stopped working. Maybe because your outlet, your.
Well, so there's a lot of things. So a good
Yeah.
history and physical. You said the blood work was good, so that's fine. So that means that rules out anemia or thyroid disease. I don't know if you also checked the vitamin D level. You should probably check that. Make sure
I take
cardiogram.
the calcium D. I do that. In fact, I asked the doctor about fish oil. He says I don't have to take fish oil.
What about the fish oil?
She-
He
Doctor
said
says
it's
you
not
don't have to take it.
necessary.
Okay, so I think at this point, probably just try to get your sugar under better control. That itself might be contributing to your
Right.
symptoms.
Do
Okay?
you think I should try a what do you call that? A rheumatologist?
Well, let me ask you sincerely, do you have good insurance?
Okay.
Yeah, I do. I have Empire Blue Cross PPO,
Well, I think you should...
and Medicare is first. That's secondary.
my office manager will call in later and let me know, but I think it's worth a try if no one else could find out what's going on.
Okay, thank you.
Have a good night. We may have an answer to the quiz. Joyce thinks she has it. Joyce,
Yes.
there's a rumor around here that you might have the answer to the quiz.
What about a balloon?
The most common thing to choke on is a balloon.
Yes.
Okay, I'm not going to pass judgment. Or what is it? Sound effects. Okay, we have sign language sound effects, and the guy's going like this. I'm very sorry, not the answer, but good guess, good guess. Where are you calling us from?
Brooklyn.
Which part?
Bed-Stuy.
Bed-Stuy. And what's out there? Any restaurants pop up in the last season?
No.
No, that's all
I
right.
usually go downtown.
Yeah, you ever go to a Queen restaurant downtown?
No, I usually go to Junior's.
Junior's. You can get an egg cream at Junior's, right?
Good choice for an egg cream, yeah. Dr. Carapati loves the cheesecake.
I have one question.
Okay.
Why is it that I can't sleep at night? And I'm 68 years old.
Okay, let's go to Dr. Carapati. Why can't she sleep at night?
Well, there are a lot of reasons, again. Depression, menopause. So, are you having any hot flashes or anything like that?
No.
No, you don't have any issue with
No.
that. Sometimes just age itself. But, you can do certain sleep hygiene measures. Do you do any kind of exercise? Walking?
Yes, I walk, and I also have like a bike.
A bicycle, good.
Yeah.
Okay, yeah, so exercise, eat an early dinner, do something relaxing before you go to bed. Even a warm glass of milk would help. Medicines would be the last resort, but you should try other measures first.
Are you taking a sleeping medication right now?
My doctor gave me hydroxyzine.
Hydroxyzine, okay.
Yes, he said it's not specifically for sleep, but it will help.
Right, it's an antihistamine, but it has sedative side effects, so we use that sometimes.
Yes.
Because, a lot of the other medications, they're afraid of, addiction and things like that. So
Right.
it's okay to try that for now, see if it works.
But thanks for the call, Joyce. We appreciate it.
Thank you.
Take care. What we're going to do now, we're going to regroup. We're going to take a short break, and when we come back, we're going to get to your questions. Topics are internal medicine, rheumatology, and orthopedic medicine. We have Dr. Kanchmala Kadapati, Dr. Bruce Garner, and Dr. Reginald Manning. Don't go away. We'll be right back. I'm Dr. Steve Garner, the host of Ask the Doctor. In addition to watching Ask the Doctor every Tuesday night at 8, you can also visit www.netny.net/askthedoctor. There you can find the topics and guests of each episode. You can read my column from the week for the tablet, and for more advice, you can watch episodes you've missed. More importantly, you can post your questions and I'll answer them on the video blog. So visit www.netny.net/askthedoctor and get your daily dose of healthy advice. And welcome back to Ask the Doctor, where our topics are internal medicine, rheumatology, and orthopedic medicine. Now let's get to the questions. I understand Nicole is waiting patiently on line 2. Hi, Nicole.
Hi.
Hi, it's good to hear from you. Where are you calling us from?
Whitestone, New York.
Whitestone, way up there. Right? So where do you like to go out? Remember the old cinemas up there? They used to have like an amusement park, right?
I don't know.
Yeah, in the old days there was a big amusement park out there.
Really?
But, so what do you like to eat out there?
What do we like to eat? Oh,
Yeah.
we like to eat everything. We got some good steakhouses around here.
What's your favorite? If you had one last meal?
Burton and Doyle.
Burton and Doyle. It's good to know about. It's
Yeah.
very good. Keep that in mind. So what can we do for you? Do you have an answer to our quiz?
I don't know. I was thinking maybe like steak or meat or something.
Okay, let me repeat the question. What is the most common thing that causes adults to choke in the United States? Could it be steak? I have some very bad news.
It's
not steak. It's not steak. But it's a good guess. I like it.
Okay.
I think it was better than balloon. But not that. All right, so what can we do for you?
Yeah, I actually had just a question. My mom was recently diagnosed with osteoporosis and through a bone density test. And she is currently taking Arimidex, which I know is known for bone loss. Her primary care doctor originally told her that he wanted to put her on Actonel once a month, which I know is good for that. Anyway, that's $90 a pill. Then he changed his mind and said, you know what, she can go on Boniva. My question was, if she goes on Boniva, is Boniva mainly for spine fractures, or does that just work just as well for someone in her case where she has it in the hip?
She's a breast cancer survivor?
Correct.
Very good. How many years?
She was actually just diagnosed a year ago, and she went through this past year surgery and chemo and all that. So
How old a woman?
65.
Okay, so let's figure out, first of all, bone density test and osteoporosis.
Mm-hmm.
Well, it's an interesting thing because the bone density test is one way of evaluating osteoporosis. But we've learned over the past 15 years, since the bone density testing became more common, that that's not the only way. That what you have to do is look at the patient's whole risk for a fracture. And that includes, what are the patient's other risk factors for fracturing? Is the patient very thin? Is the patient very light-skinned? Does the patient have a low level of vitamin D? Does the patient have a family history of fractures from osteoporosis? Has the patient shrunk or curved over? Does the patient drink alcohol a great deal? Does the patient keep away from dairy products? So these are all things which are very important. The bone density in and of itself is not the only thing we use to diagnose osteoporosis nowadays.
Reggie, let me ask you a question. You're seeing a lot of fractures related to osteoporosis?
As the population ages, yes. Particularly more over the winter when you have the ice and snow on the ground, fair amount of wrist fractures, ankle fractures, hip fractures. Sometimes you see them in younger people, but more traumas involved.
Do you find that's the first, when they come in with the fracture, they didn't even know they had osteoporosis?
Well, I don't do the bone density testing. That's more the internist territory. I just treat the fractures. So I don't know if I can give you a good answer for that.
But we have somebody who might. So Dr. Carapati,
What was the question?
What was the question, Reggie?
about the bone density.
Is a fracture the first indication of osteoporosis?
Right.
It might be.
Sometimes they come in, they get a fracture, they didn't even know.
No, I mean, I usually do a screening, DEXA, bone density test. And, more than anything, prevention. Before, we got to prevent them getting to Dr. Manning.
Wait a
that's
minute.
my job.
Wait a minute. I got to make a living, too.
That's my job as an internist. So, after the mostly postmenopausal women, or if they have certain medical conditions like he was mentioning, or if they're a smoker, or if they have high risk because of medications that they're on, like steroids.
But what about vitamins? Everybody,
Yes,
it's on everybody's mind. What level should they be?
I was getting to that because that's another thing, especially if you have poor intake or at a certain age, then you have to take adequate vitamin D and adequate calcium. So the recommendations changed. It's at 1,000 IUs now. I mean, it used to be 400 and 800, now 1,000. Calcium also, you need to take like at least 1,500 milligrams of calcium. Actually, the best way to get vitamin D is exposing yourself to sun. So, without sunscreen, just 10, 15 minutes in a safe way. If you can get sun, that's the best way.
That'll do it.
Yeah.
Very good.
Or get the supplements. Yeah.
Okay. So we'll put that to rest. Thank you very much for the call.
I actually had one more question, really.
Maybe quick question, if it's quick. What is it?
Yeah, her doctor actually wanted to put her on Actonel, but then he said, okay, Boniva, because Actonel was very expensive.
You were right about that, and I guess Dr. Garner can weigh in, but yes, Boniva is more for spine, so you would be better off with the Fosamax or Actonel to prevent hip fractures.
Okay.
Studies have shown that those are better.
Okay.
Dr. Garner?
Nothing to add.
But there's more femoral shaft fractures. Even though hip fractures are getting less, femoral shaft fractures have increased on the bisphosphonates.
Wow, yeah.
So there's no free
Nothing
lunch.
comes free.
No free lunch.
You got to figure out the risks and the benefits. I think we're all in favor of her taking
Yes,
Take
at
some
the
medication.
present
So
time.
we like you to take that medication.
But not the Boniva, okay.
Yeah.
Okay?
Okay, thank you very much.
Good luck.
Thank you.
Now, the Jane is on line 3 with the answer to the quiz, maybe. Hi, Jane.
Hi, how are you?
Hi, where you calling us from?
Middle Village.
Middle Village. Is there a place to get an old-fashioned egg cream out there?
Yeah, Eddie's on Metropolitan Avenue.
Oh, is that the old soda? It looks like an old soda fountain place?
Right.
Oh, that's a great place. Yeah, you go in there,
Yeah.
great to take kids to, or go in after a party or something.
It's right near the movie theater.
Right near, you catch a movie and then you go into Eddie's. That's great.
Right. It's right near the Cinemark.
Egg creams, are you a good maker of egg creams?
No.
I'm the best.
Oh, yeah.
Okay.
You're good?
I'm a good drinker, but not a
Jane,
good
you're
maker.
good?
Yes.
You get a nice that white foam on top?
Yes.
I love that. All right, one time we have to get together. What can we do for you?
Okay, the answer to the quiz, I believe, is food in general.
Okay, is the answer to the quiz food in general?
Tell her to be more specific.
No, I'm sorry. I'll give you, you want to be more specific?
Well, toys for kids.
Wait, food. No, type of food.
Let's see. No, candy.
Okay, we're going to go to candy.
Or
Is
popcorn.
it candy?
Popcorn.
No, it's not candy.
Popcorn.
This was the
Only
baseball
one
game.
guess.
Buy me some peanuts and crackers. What is this?
Only one guess.
No, but thanks a lot. And do you have a medical question?
Yes, I do.
What can we do for you?
Recently, I was diagnosed with breast cancer.
Okay. Sorry to hear it.
I had surgery in February. I haven't started any treatments yet. So I have to go tomorrow and have a lung biopsy because they found a nodule when they did a CAT scan.
Okay.
So how do they, what's the procedure? How do they do that?
Yeah. What they're going to do is they're going to put you under the CAT scan.
Uh-huh.
And then they're going to numb up the area. And they're going to see where they want to take a biopsy, where the nodule is. And then they're going to put some local anesthetic like the dentist would do, only this time under the skin in the back. And then they put a very, very thin needle. They guide it right into the area where the nodule is. And they take a little piece of it. It has a little cutting edge on the end. You won't feel anything because they're going to put anesthetic. And then they're going to send it off to the lab and evaluate what it is. Hopefully it's going to be, nothing, something that's been there a long time.
And how long does that usually take?
45 minutes. You should be done.
And what's the risk of that?
Sometimes the lung can collapse, but if it does, and if that rare event occurs, they can re-expand it very quickly by putting a tube in. But it most likely won't require that. Most likely it should be uneventful. You'll go in 45 minutes and be done. It'll watch you for a couple hours, and then you'll go home.
Sounds very painful.
No, but they give you enough anesthetic. There is some discomfort, but the anesthetic really keeps it down to a minimum.
Really?
How old are you?
61.
61. And were there any lymph nodes involved?
They took out 13 lymph nodes, and 7 were positive.
Okay. So what did they say? Did they're going to treat you with chemotherapy?
Well, that's what the oncologist is waiting to find out, because she said this way it would change my course of treatment.
Right. Please let us know, okay, next week how it went. Don't worry, you should go through that test with no problem at all. It should be.
I wanted to ask you one more question.
Yes.
You know your eyebrows, if they don't grow in or they're very sparse and you hardly have any hair, is that an indication of thyroid?
Okay, let's, Dr. Kadapani, thyroid disease.
Well,
hair falling?
sometimes, yeah, when you have low levels of thyroid, you can have, the lateral, meaning the outside of the eyebrows, you might lose the hair. But, that's unusual. It might just be, so you have very sparse eyebrows?
Very scarce eyebrows.
Yeah, that might be just constitutional, meaning
no,
that's
plus
the way your body is.
I'm also very constipated, cold.
Well, then you should check your thyroid levels. Yeah.
They checked it and it came back fine.
It came back fine. Okay,
but
so
they
I
didn't
mean,
do. But they didn't do the TS3. They only did the TS4.
Okay.
I didn't get that.
The
What
free
did you say?
T4, they didn't do the T3.
Yeah, the free T4 and the TSH. If those were normal, then you don't have any thyroid condition.
They didn't do the 3. They only did the 4.
Yes.
That's fine.
That's fine.
Uh-huh. Okay.
But anyway, don't lose sleep over this tonight. You're going to go through this fine, and really, you're going to be surprised. It's very quick, and it's not going to hurt you as much. Little discomfort, but not a lot of pain.
The problem is, also I'm a diabetic, so I can't take the medication in the morning.
Well, they're going to take you first, I hope, right? Because of that.
No, not till about 10:30.
Okay, when you get there, ask them if you could take your medication.
They said not to take it.
Just ask them again when you get there, okay?
Okay.
Okay, take care.
Okay, you too. Bye.
Bye. I was going to ask Dr. Manning about this robot surgery. Maybe it's kind of foreign. I don't know exactly if the audience knows what it is. It's not an actual robot, is it? What is it?
It's a machine that makes more precise cuts because it's very stable than a human being could. And if you're trying to make drilling for, say, total hip replacements on the femoral side and acetabular side, you can get very precise cuts with that. I don't do it myself, but I've read about it and heard about it.
So it's up and coming.
Up and coming.
Excellent. Okay, let's go to Linda on line 1. Hi, Linda.
Hi, how are you?
Good, thank you. Where are you calling us from? Linda? I think that electrical storm got Linda.
Cheap cell phone.
Okay. Linda, you can call back, and we'll get back to you, okay? We're going to move you up front. Let's go to Cassie now. Hi, Cassie.
Hi.
How are you?
Good.
Where are you calling us from, Cassie?
Brooklyn, New York.
Which part? Which part are you calling us from?
Ocean Avenue.
Oh, not far from here. And where? Ocean and where?
On Avenue L and Ocean Avenue.
Beautiful area, right?
Yes.
Where do you go in there to eat? You go to Avenue M?
Avenue L. Oh, I don't eat out much.
Oh, you like to cook?
Yes, very much.
Very good. So you do have an answer to the quiz?
Yeah, I thought it was candy.
Okay, is it candy? I'm sorry. It's not candy, but it's a good guess.
Okay.
What can we do for you?
Oh, I just wanted to answer the question.
Anyway, call back if you get another answer, okay?
Okay, thank you.
Take care. Let's go to Maria now. Hi, Maria.
Hello?
Maria.
Hello?
Hi, Maria.
No, this is Elizabeth.
Elizabeth, hi.
Hi.
How are you doing?
Okay.
Very good. Where are you calling us from?
Staten Island.
Way out there. What's going on out there tonight?
Nothing too much.
Can you get an egg cream in Staten Island?
Yes, you can.
Where?
There's a place on Forest Avenue called Eggers.
Eggers?
Yes.
Oh.
Makes sense.
It's the good old-fashioned one, right?
Yes, it is.
What kind of syrup do they use? You bet?
No, they have regular, like, soda fountain.
Yeah, but maybe shouldn't it be you bet syrup?
You bet chocolate syrup.
Sure,
I'm not sure.
All right. And you get a pretzel with that? Remember those pretzel rods?
Mm-hmm.
Those were the good old days. What can we do for you?
Well, I might have an answer to the quiz.
Oh, okay, everybody's waiting to feel, because we don't know what it is, actually. What do you think it is? What's the most common object people choke on?
I'm thinking water.
Water. Interesting guess. Hello?
Yes.
Didn't work out.
Okay.
Not water, but I'm glad you give it a try. You give it a try. That's all.
But I have a question also.
What's the question?
Okay. I've been having a problem with vitamin D level for a long time, and for some reason they can't get I take a supplement, a prescription supplement, and I can't go above 11. I mean, is there something else besides? I don't know how. Right now, I'm taking like 200,000 milligrams a week.
I'm going to go around the table here. Dr. Garner, you want to start?
Well, the current recommendation is you want a vitamin D 25 OH level, which you can monitor in the blood, of 37 to 100. If you have osteoporosis and you're taking medication such as we spoke about before, like Boniva or Actonel or Fosamax, it's probably better to be at 50 or above. One of the things you may want to see if you're taking that much vitamin D and you're not achieving a higher level is, do you have a malabsorption syndrome? And that might be something to discuss with your internist or with the gastroenterologist.
Let me discuss with the internist. What percentage of patients coming in with vitamin D deficiency just have malabsorption syndrome and aren't getting it?
It's a small percentage. It's more common that, inadequate sun exposure and inadequate intake, malabsorption is a small percentage. But in spite of adequate replacement, if you're not getting the levels up, then you should see your medical doctor to get evaluated for that.
Reggie, are they doing, when someone comes in with a fracture, are you giving extra calcium at that time to these? I heard some people were doing that, but really hasn't been proven to.
No. If they have any issues, I would refer them to the internist for that. But my other concern about inadequate vitamin D, it's metabolized in the liver and the kidney, and if they have any liver or kidney disease, that might prevent it from getting to the more active form. So.
Okay, so we got a lot of calls. We're going to get to you. We're going to do the rapid fire segment. We're going to go to email in 1 second. We're just going to take John first and then move on. John?
Yes.
How are you doing?
Okay.
Where are you calling us from?
Bensonhurst.
Bensonhurst. That's a lot of places out there, right?
Yeah. Yes.
What do you like? What do you go for?
What do you mean?
Well, you got to go out, right? You have friends coming over. You want to impress them, take them to a nice place. What do you do?
I don't really go to restaurants.
You would cook something at home?
Cook something at home, yeah.
All right. What's that nice? There's a nice pizza type restaurant on
Gino's.
I love that. I always forget the name.
Oh yeah, Gino's is great. Yeah,
that guy's good, right?
They're up on 5th Avenue and 75th.
Yeah, they make you feel special when you go in there.
Yeah, that's a nice place. I went there since I was a kid.
Yeah, that's a good place. There's a good place in Park Slope actually that I ate at called Okinawa's.
Okinawa's?
It's a Greek place. Amazing. They give you beautiful portions, and they're so nice in there. Big fans of the show too.
Really?
So you want to go in there. It's on 7th Avenue and 9th Street.
7th and 9th?
Or 8th, yeah,
my,
8th and
my,
9th.
my sister works down there. I could ask her about
Ask her
that.
about Okinawas.
Yeah.
All right, what can we do for you? You have an answer to the quiz?
I would think something like dry, like crackers, but I don't think so.
I think crackers. I think we're going downhill. John, I'll ask him. All right. Okay, answer done. Not correct. But what's the question, the medical issue?
The fibromyalgia, the 18 sore points.
Okay, we're going to do this in
There
30
are
in a
certain
minute.
tender points that in the traditional diagnosis of fibromyalgia, where you apply very little pressure, and people who do not have fibromyalgia will just say, I feel some pressure. People who have fibromyalgia will say, wow, I have severe pain there. Now, there is a movement afoot to recategorize the definition of fibromyalgia, because not all of these points may be tender at the same time. So there are some physicians who are experts in the field who feel that just diffuse pain by itself should be enough without the 18 tender points.
John, that helps you?
Yeah, but see, my doctor pressed me on my waist area in front, on this towards the side, but it's sore on the side, down a little further.
Well, you might have fibromyalgia based on the new definition.
But so it has to be that exact point, though. It ain't the one on the side like I get.
Based upon the old definition, it has to be that exact point.
Oh,
but
okay.
as I said, there's a movement afoot to change that definition.
Okay, we hope that helps you, John. We're going to move on. We're going to our rapid fire segment, and the first one's going to be an email. And in this segment, we get to questions. We answer them in 30 seconds, and then we'll move on to the next one. So Lisa from Brooklyn emailed. She has a comment regarding youth and sport, very similar to the defibrillator segment we did on February 15th. And that was a tragic incident of a young boy who had ventricular fibrillation. That's a rhythm that you collapse with and die, and there was no defibrillator or something to shock him with. So the email says, you don't need to be sick to have a well checkup with a pediatric cardiologist. We have a 17-year-old son, 5'9", athletic build, loves sports, loves playing sports since he was 4. At the age of 6, the son was playing hockey indoors, basketball, and baseball. Then he began having breathing problems. He would turn red in the face after each game, but never a complaint. We decided to look into this. He had asthma brought on by exercise, 2 puffs of inhaler before a game, and he was good to go. After a follow-up visit with the pulmonologist, he suggested we see a pediatric cardiologist just for a routine checkup, which he said only a 15-minute exam. Cardiologist? He was only 6 years old. After thinking about it for weeks and hearing the same advice over and over, I made the appointment. This pulmonologist saved my son's life. He was diagnosed with bicuspid aortic valve, so that's a deformity of the valve, and now an enlarged heart. At 6 years old, it was faint and would never have been picked up with a routine visit. If we didn't know this, he'd continue to high school sports where it's more intense and who knows what might have happened. So it's a message, I guess, to everyone. As we watch the nightly news and yet hear another episode of a high school athlete dying, how do we get the words out that checkup and mandatory cardiograms are important? And I think you help to get the word out. Parents out there with children should consider going to a cardiologist before they're participating in sports. This was kind of killed the rapid fire segment, but I think it's a very good question, and I'm glad you got it in. So thanks a lot. Okay, let's move on to our question now. We have Sharon. Sharon.
Yes.
How are you?
I'm good, thank you.
Do you have an answer to the quiz?
I was thinking it was chewing gum.
Chewing gum. Interesting. Oh, I'm sorry. I thought that was a good guess.
Good guess.
Very good.
Oh, well.
What can we do for you?
Well, I was just calling to ask the doctor if there was anything over the counter I could possibly take. I have really bad knee pain, and I'm on blood pressure medication, so I just didn't want to take anything. I was looking at some Aleve, I was looking at some Advil, and I just didn't know which one I should take, being that I do take the blood pressure medication.
Okay. So let's, 30 seconds.
Aleve is certainly relatively safe, as we mentioned before, with cardiovascular problems, but since you're on blood pressure medication, you might do better with a topical medication, such as Zostrix, which is actually crushed chili peppers. You put it on 2 to 3 times a day in a thin layer using a glove in the affected area, and that may help control the knee pain without taking something by mouth, which could have effects on the blood pressure.
I'm sorry, we got to move on because it's so crowded.
What is it called again?
Zostrix, Zostrix.
Okay, thank you.
Thank you. And now I want to give a little hint. It's not food. The answer is not food. So let's go to Sandra. Hi, Sandra.
Hi. How you doing?
How you doing? Let's hear you talk nice and loud.
okay.
So, okay. Do you have a quiz answer?
No, to be honest, but I just want to ask you a question.
Sure. What's the question?
My son just had a car accident,
Sorry.
and he was hit by a car going to school, and the doctor wanted to do surgery. So the doctor said if he don't do the surgery, he's going to be in the cast for about 3 to 4 months.
What did he break? What did he break?
He broke his foot.
Broke the foot.
Yes.
Dr. Manning.
Generally, we like to repair those fractures because casts don't hold things as well as you think. Usually when you fracture something, you're going to bleed and swell, and as you heal, the swelling goes down, so things can shift in casts. And feet are very, very subtle, very important instruments, and if they're not just set properly, healed properly, you can have problems going forward the rest of his life. So I'm not saying he has to have surgery, but that if there's any displacement and it's not well controlled, he may be better off with that.
He better off with the surgery.
He may be, but I haven't seen any x-rays and haven't examined your
Maybe
your
get a
child.
second, if you need a second opinion.
That's the way to go.
Okay. We're now going to go to Audrey. Audrey? Hello?
Yes,
Hi, how are you? Do you have an answer to our quiz?
I have an answer to the quiz. I think it's saliva.
Saliva.
Yes.
Okay. No, not, but it's a good, it's a good thought. Thick saliva. Do you have any quick medical question for us?
What's good for arthritis in the back?
Well, I would start with a non-steroidal anti-inflammatory for any arthritis. It could be something over the counter like Aleve or Advil, or if that's not working, you can get a prescription strength. And sometimes some physical therapy may be helpful as well.
Tylenol. Tylenol is the safest, unless you take it too much, but yeah, it's good.
Okay, I hope that helped. Tylenol. Interesting. Do you agree?
Tylenol is very good
Great.
in weight loss also if you're overweight because the back supports a good deal of the
Excellent.
body's weight.
Let's go now to Linda. Linda,
Hi, good evening. How are you?
I hear rumor you have the answer.
Huh?
You have the answer to the quiz?
I don't know. Could it be ice?
Ice, and that's what Grace wanted. I'm sorry, but Grace actually wanted ice. We're back to full circle. I want if our control people can give me the answer, I'm going to give it over the show.
I have a question.
Let's hear the question.
Okay, my mom, she's 66 years old. She's diabetic.
Okay.
And also, she has screws in her ankle. And she took an x-ray, and the doctor said everything is fine. My mom walks like she's bending over, like she's going to fall, and she walks like she's about to run. Last month, she was getting off the train. She couldn't get up, and she got off at the wrong stop and fell on her face. The cops called me, and I went to the train station to get her. Her lips was bleeding. She walks bending over like she's going to fall. And I don't know. One doctor said that it could be, oh my God, I forgot that kind of disease or whatever that makes you shake.
Parkinson's.
Okay, so
Yes,
I mean,
Parkinson's,
what's
but
your
I know-
thoughts, Dr. Karapani?
Well, one of the things, since she's a diabetic, sometimes diabetics can develop what they call proximal myopathy, where there's weakness of the muscles. You said she sits down and she can't get up. So, maybe seeing a neurologist to get that evaluated probably is a good idea, okay? So basically it's just weakness in the muscles that develops in patients with diabetes.
So we want her to get into a neurologist.
Yes.
You hear that?
It doesn't sound like Parkinson's. I think you were thinking of Parkinson's when you said the shakes. It doesn't sound like
So
that.
Linda,
just-
get him into a neurologist.
Some osteoporosis, she's bent over.
Yeah,
I was
it could
gonna
be
ask that bent over.
osteoporosis too. Yeah, I was just thinking.
Is that a pathognomonic? I think I was at a lecture that you gave, Dr. Garner, and you talked about
When
bending
people
over.
start to bend over, curve over, or shrink, that pretty much means they have osteoporosis.
Thank you. Now we're going to go to Phyllis on line 4. She may have the answer. Hi, Phyllis.
Hi, Dr. Gardner.
Hi. Where are you calling us from?
I'm calling from Howard Beach.
Interesting. I was out there at Frank Russo's place. Did you go to the new restaurant?
Yes, I have.
It's good. Russo's on the bay, right next door. Beautiful restaurant.
Oh, yes.
What's the name of that?
Oh, it just went out of my head. Vitro.
Vitro?
Vitro, yes.
Vitro. What can we do for you? Do you have the answer to the quiz?
Well, I thought I might, but then you just said that it's not food. I thought it might have been chicken bones.
It's not chicken bones. I'm sorry. But I'm going to have to give a quiz. It's something a restaurant gives you on the way out. You can so often pick it up on the way out in a little container as you're walking out. Okay?
A mint?
Mint is not correct, but think of other things. Is there a quick medical question?
No, thank you.
Okay, I'm sorry.
I enjoy your show.
It's great to hear from you.
Thank you.
Take care. Let's go to Joyce. Joyce,
Yes, hi.
you're walking out of the restaurant, you put something in your mouth, you choke on it. What is it?
I thought it was a chicken bone.
Chicken bone? What, are they giving chicken bones out as you walk out? Joy, what are you eating?
God. Oh, you walk out of the restaurant.
Yeah, it's a
Sorry.
nice restaurant. They have something there.
How about a mint, a little mint?
Little mint. No, I'm sorry. We're going to move on to Maria on line 1. Hi, Maria. Maria? Okay, I think Maria got nervous. Maria? Okay, let's go now. Hello?
Good evening.
You think you have the answer?
Toothpick.
Toothpick is correct. I have to clap. It was like work. I'm exhausted now.
It was the toughest quiz.
I don't know. Whoa, did you? I never heard. That was one of the toughest ones. That's it for Ask the Doctor this week. I want to thank Dr. Kanchmala Kadapati, Dr. Bruce Garner, and Dr. Reginald Manning for coming in. By the way, you're going to get a plaque, so hold on. We hope that we've been able to help you. It's good to remember you should always be proactive about your own health. Speak to your doctors. Speak about your concerns. Go for second or third opinions like we heard tonight. In the meantime, visit our website at netny.net/askthedoctor for my video blogs, the tablet column, podcast, the forum, and many more. Thank you, Dr. Linda Lapatosa, the quizmaster, for your question. You stumped us tonight. Remember, stay on. You're going to get that plaque, beautiful Japanese plaque. You're going to love this. Hang it on the wall there. Dr. Manning has one, right?
I
Can't
never
find
saw
it. Okay. Anyway, I want to say goodbye, and I'll see you all on the tablet. Take care. Be well.